All right, let's dive into COPD today. And don't worry, we're not going to make this some boring medical lecture. We're going way deeper, getting into how routine tests can give us amazing insights into how your lungs actually work.
Sounds good.
Yeah, so we'll look at how something as simple as like blowing into a tube, think high-tech birthday candles, that's spirometry, how that can tell us a ton about your lung health.
Uh-huh.
We'll even like decode that FEV1 FVC ratio, the one doctors are always talking about.
Right.
And get this, we're even going to find out how a blood test can reveal if you're genetically predisposed to COPD.
Okay.
That's called alpha-1 antitrypsin deficiency. And of course, no worries, we'll explain what that means and why you should even care about it.
Of course.
Then there's a whole bunch of other tests, ABGs, CBCs, even sputum cultures. Each one adds another piece to the puzzle of how healthy your lungs are.
Exactly.
And to help us put all these pieces together, we've got our expert guide with us today.
Happy to be here.
So, like, when we say COPD, what exactly are we even talking about?
So, COPD, that stands for chronic obstructive pulmonary disease. It's a lung condition. Gets worse over time, makes breathing harder and harder.
Okay.
It's like an umbrella term, covers things like emphysema and chronic bronchitis. Basically, with COPD, air can't flow in and out of your lungs as easily, really impacts your life.
So, more than just a cough, huh? It's like airflow getting blocked, gradually.
Exactly. It's progressive, and that's why getting diagnosed early is so important.
So you can start managing it, right?
Exactly. Early diagnosis and management are key with COPD.
Okay.
Sooner we find it, sooner we can do things to slow it down and help people live better.
Right, because you can't, like, reverse the damage already done, can you?
Unfortunately, no.
Okay. But at least you can stop it from getting worse.
Absolutely. That's the goal.
You mentioned spirometry earlier.
Yep.
How can just blowing into a tube tell us so much?
Well, think of your lungs like balloons. They inflate and deflate every time you breathe. Right? Spirometry measures how much air you can blow out and how fast you can do it. Gives us info about your lung capacity and how well they're working.
So it's not just how much air, but also like the speed.
Exactly. That speed can be really telling when it comes to COPD.
Okay, that makes sense. You also mentioned FEV1 and FVC and a ratio. What's the deal with those numbers?
So FEV1, that's forced expiratory volume in 1 second.
Okay.
It tells you how much air you exhale in that first second. Then there's FVC, forced vital capacity. That's the total air you exhale after taking the deepest breath you can.
Right, right.
And the ratio of those two, FEV1, FVC, that's really important for COPD.
So it's the relationship between them, not just the numbers themselves.
Exactly. Like a secret code for lung health.
Uh-huh. Love that. What's the number we're watching out for?
Anything below 0.70 is a red flag.
Okay.
Means your airflow is obstructed. Classic COPD.
Gotcha. But you also said blood tests are part of the COPD picture. Why are those important if it's a lung problem?
Well, blood tests can show us a lot about someone's overall health, which is super helpful with something as complex as COPD.
Makes sense.
They can show us oxygen levels in the blood, if there are any infections, and even if you might be genetically more likely to get COPD.
Wow. Let's start with ABGs, arterial blood gases. Sounds scary. What's that all about?
Don't worry, it's not that bad. ABG analysis is basically about seeing how well your lungs are doing their job, exchanging oxygen and carbon dioxide.
Right, got to get that oxygen in, get the carbon dioxide out.
Exactly. This test measures the levels of those gases in your blood, tells us if your lungs are working properly.
So it's like a direct look into how efficient our lungs are being.
You got it.
What do we want to see in those results?
Mainly, we're looking for two things: hypoxemia and hypercapnia.
Big words?
Hypoxemia just means low oxygen in the blood.
Oh, okay.
Could mean your lungs aren't absorbing enough oxygen. Hypercapnia is high carbon dioxide levels. That could mean your lungs aren't getting rid of the carbon dioxide properly. Both of these can be a sign of breathing problems, especially worrying in someone with COPD.
Gotcha. Low oxygen, your body isn't getting what it needs. High carbon dioxide, waste is building up. Now, what about CBC, complete blood count? Isn't that just a routine checkup thing?
It is a common test, but it can also tell us some surprising things about COPD. For example, we might see high red blood cell counts in people with COPD.
Really? Why would that be higher if someone's having trouble breathing?
It's actually the body being smart. When oxygen levels are constantly low, your body tries to compensate by making more red blood cells.
Oh, I see.
Those are the cells that carry oxygen around the body. It's like the body trying to make up for the lungs not doing their job well enough.
Wow, so even something as simple as a red blood cell count can tell us about how the body is dealing with COPD.
Exactly. There are clues hidden everywhere.
You also mentioned alpha-1 antitrypsin deficiency earlier. Sounds like a mouthful. Break it down for us. Why is it related to COPD?
So imagine this protein, alpha-1 antitrypsin, as a bodyguard for your lungs.
Okay,
It protects the delicate lung tissue from getting damaged.
got it.
But some people don't have enough of this protein. It's a genetic thing.
Hmm.
It's like their lungs are missing their bodyguard, makes them more vulnerable to damage and more likely to develop COPD.
And that can happen at a younger age, right?
Exactly.
So this blood test, it can identify those people who might be at risk.
Exactly. Testing for alpha-1 antitrypsin deficiency is really important, especially for those with a family history of COPD, or if someone starts showing symptoms younger than usual. Early detection can make a big difference.
So we can catch it early and maybe slow things down.
Exactly.
All right, so we've got breathing tests to see how the lungs work, blood tests to look at oxygen levels, infections, even genetic risks. It's incredible how much we can learn from all this.
Absolutely.
Before we move on, can you give us a real-life example of how these test results can help us understand someone's COPD?
Sure. Remember that FEV1 FEC ratio we talked about?
Hmm.
Let's say someone gets a result of 0.60.
Oh, that's below 0.70, right?
Right. That's a sign of limited airflow, which is a key feature of COPD. Now, we wouldn't diagnose COPD based on just that one number.
Right.
But if we put that together with other information like the person's medical history, what symptoms they have, maybe a chest x-ray showing hyperinflation, then it all starts to point towards COPD.
So it's not just one test, it's putting all the pieces together
Exactly.
like a puzzle. And that's where doctors come in, right? They can look at all this and make sense of it.
Right. They can see the bigger picture and make decisions about how to manage the COPD.
That's really helpful to understand. So we've covered the main test, but I'm curious now about what it's actually like to live with COPD.
Yeah, that's a really important part of the story, and we'll get into that more in the next part of our deep dive.
Okay, sounds good.
We'll explore how COPD can show up in someone's life, the challenges they face, and how they can manage it to live a good life.
That's what we want to hear.
Definitely. Stay tuned.
All right, looking forward to it. Back again, diving deeper into COPD. It's pretty wild how much we can learn from these tests.
It really is a lot of information packed into those results.
Before we keep going, though, I'm curious. What's it actually like for someone living with COPD day to day?
Right. Yeah, we've talked about diagnosis, but what does it actually feel like?
Exactly. What are the challenges?
Well, the thing is, those tests give us the data, but everyone experiences COPD differently.
Makes sense.
But some common things people experience are that cough that just won't go away,
Okay.
shortness of breath, wheezing, that tight feeling in your chest.
So not just a cough now and then. It's like
Right.
you can't breathe easily, ever.
Yeah, imagine trying to breathe through a straw all the time, even doing simple things.
Wow.
That's what it can feel like with COPD.
I bet that makes, like, everything harder.
It does. Everyday stuff, even climbing stairs, getting groceries, even just talking to someone.
Yeah.
It can be so tiring. And it gets worse over time.
Oh, man. So as it progresses, it just gets harder and harder to do, like, anything.
Yeah, even the easiest things can feel impossible.
So is there anything that can be done to, like, fix the damage? Is there a cure?
Unfortunately, right now, there's no cure for COPD,
Oh,
but there are treatments and therapies that can help manage the symptoms,
okay.
slow down how fast it gets worse,
Right.
and really improve quality of life.
So even though we can't, like, undo the damage,
Yeah.
we can help people live better.
Exactly. That's the goal.
So what are those treatments?
Well, it depends on each person and how severe their COPD is.
Sure.
But usually it's a combination of medications,
Uh-huh.
pulmonary rehab programs, and lifestyle changes.
Okay, let's break those down. What kind of meds are we talking about?
One of the most common ones are bronchodilators. They relax and open up the airways.
It's easier to breathe, right?
Exactly. Makes it easier for air to move in and out. Then there's inhaled corticosteroids.
Okay.
Those help reduce inflammation in the airways.
Oh, right, because inflammation makes it harder to breathe, too. So those meds target the two main problems with COPD.
That's right.
And you mentioned pulmonary rehab. What's that like?
It's a whole program, combines exercise, education about COPD, and support groups.
So it's not just physical therapy.
It's more than that.
Okay.
It helps people learn how to manage their breathing, strengthen their muscles, and exercise better. And it gives them a place to connect with other people who get it.
I bet that's super helpful. to talk to people going through the same thing.
It can make a huge difference.
Now, what about lifestyle changes? What can people do on their own to manage their COPD?
This is really important. First and foremost, you have to quit smoking.
Yeah, it's got to be rough on already damaged lungs.
It is. Smoking is the main cause of COPD for most people.
Right.
And if you keep smoking, it just gets worse faster.
So quitting, that's the most important thing someone can do.
Absolutely. Even if you've smoked for years, quitting will protect your lungs.
Okay, what else can people do?
Eating healthy, a balanced diet, is important for everyone.
Yeah.
It can help your lungs function better, too. And staying active, even if it's just walking, can help strengthen your lungs.
Really? But isn't it hard to exercise when you can't breathe well?
I know it seems weird,
Yeah.
but even moderate exercise can make a difference. It helps your breathing muscles get stronger, improves your circulation,
Okay.
and it can actually make breathing feel easier in the long run.
So it's about building up slowly, not pushing too hard.
Exactly. And talk to your doctor about what's safe for you.
Right.
Other things that can help are avoiding air pollution
Oh, yeah. Makes sense. That can irritate your lungs.
and getting vaccines for respiratory infections like the flu and pneumonia.
Right. Those can be dangerous for people with COPD.
Exactly.
So it's a whole lifestyle change, not just one thing.
It's about managing all the factors that can affect your COPD.
And taking control of your health.
Exactly. You have
Yeah.
to be proactive.
So medications, pulmonary rehab, lifestyle changes. It's like giving people the power to manage their COPD.
That's the goal. And of course, seeing your doctor regularly is important too.
To check in, make sure things are working.
Exactly. They can adjust your treatment if needed and answer any questions you have.
It's great that there's so many options for people with COPD.
It is. There's a lot we can do to help.
What about the future of COPD treatment? Anything exciting happening?
Oh, definitely. There's always something new.
So it seems like there's a lot of hope for the future of COPD.
Oh, definitely. There's so much research going on. It's really exciting.
Can you give us a glimpse into what's getting researchers so fired up? What's on the cutting edge?
One area that's really hot right now is targeted therapies.
Targeted therapies, huh?
Yeah, so instead of just treating the symptoms, they're going after the root cause of COPD.
So like a more precise approach.
Exactly. For example, they're working on drugs that target specific inflammatory pathways that go haywire in COPD.
Wow. And what's the hope with that?
The hope is that it could actually slow down the progression of the disease, maybe even stop it altogether.
No, that would be huge. What else is out there?
Well, this one's really cool. Stem cell therapy.
Stem cells for lungs. How does that even work?
The idea is to use stem cells to repair the damaged lung tissue.
Like rebuild the lungs from scratch?
Sort of. It's about trying to restore the lungs to a healthier state.
That sounds pretty sci-fi. Is it really possible?
It's early days yet,
Oh.
but the early research is looking promising.
Hmm.
There are quite a few clinical trials happening right now to see if it's safe and effective.
So maybe not mainstream yet, but there's a chance it could be a real treatment option down the road.
Definitely a possibility. And it's not just about new drugs and therapies. There's also this big push for personalized medicine.
Personalized medicine, what's that?
Basically using your genetic information to figure out the best treatment plan for you.
So like custom-made treatment for COPD.
Yeah, exactly. By understanding your genes and how your body reacts to different treatments, we can make better choices about what will work best for you.
That makes a lot of sense. It seems like technology is playing a big part in all these advances.
Absolutely. There are all sorts of gadgets and innovations that are changing the way we manage COPD.
Like what?
Well, there are these smart inhalers now. They can track how often you use your medication and send the information to your doctor.
Wow.
There are even wearable sensors that can monitor your lung function all the time.
So they can warn you if something's wrong.
Exactly. It's like having a personal lung monitor right there with you. And of course, there's telehealth.
Right? See your doctor online.
Yeah, it makes it easier to get expert care, even if you don't live near a specialist.
So it's not just about those once-in-a-while doctor visits anymore.
Nope. Now people have more tools and resources than ever to manage their COPD every day.
That's awesome.
It really is. And that's what I want people to take away from this. COPD is serious, but it doesn't have to control your life.
Yeah, that's a great message.
If you stay informed, work closely with your doctor, and take advantage of these new advancements, you can live a great life, even with COPD.
Well said. This has been such a fascinating deep dive into COPD. We've covered so much ground. But before we go, I want to leave our listeners with one thought. We've learned a lot today, but every case of COPD is different. So What would you ask your doctor if you were worried about COPD?
That's a great question.
Don't be afraid to ask questions. Advocate for yourself and be involved in your healthcare. Your health is worth it. And this is just the start of your journey.
It is. There's so many great resources out there.
Yeah, the American Lung Association, the COPD Foundation, there's a ton of information available. Keep learning, stay curious. Until next time, stay healthy.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.